My name is Kaliana Martinez, and I'm going to be discussing the stigma, prejudice, and discrimination that many people with mental illness experience, as well as the appropriate language that is needed to address and change the issue. The inequality against people with mental illness in healthcare remains a significant barrier to treatment and outcomes. These issues affect not only access to care, but also the quality and experience of care people receive. Stigma involves negative societal attitudes towards individuals, often rooted in misunderstandings and fear. These attitudes can lead to prejudice, where internal biases among healthcare providers influence how they perceive and treat patients. And as a result, discrimination can occur, showing up in behavior and actions such as dismissing a patient's physical symptoms or limiting their access to necessary care. There are also different types of stigma to consider. Public stigma refers to the negative attitudes widely held by society. Common myths, such as the belief that people with mental illness are dangerous, incompetent, or to blame for their conditions, contribute to this stigma more. Research by Corrigan 2014 found that 75% of individuals living with mental illness experience stigma in some form. Individual stigma occurs when a person internalizes these negative societal beliefs, and this can lead to feelings of shame, low self-esteem, and a reluctance to seek help when it's needed most. These negative connotations can lead to serious consequences, such as patients who avoid seeking care or face significant barriers to accessing the services they need. And even when care is accessed, the quality of treatment tends to be lower, with patients experience rushed consultations, overlooked symptoms, and less thorough care. Over time, these challenges contribute to worse overall health outcomes for individuals with mental illness. And despite the prevalence of individuals with mental illness, 53% out of 2,000 participants in a survey conducted by Mental Health disagreed that society is generally caring and sympathetic to people with mental illness. Research also supports these findings, and a 2017 study by Oxel, who followed over 200 individuals with mental illness for 2 years, found that higher levels of self-stigma were associated with poor recovery outcomes. This link was also observed at both the 1-year and 2-year follow-up points. These results highlight the urgent need to address stigma within healthcare in order to promote better recovery and overall well-being. So who's affected and how is bias expressed? People with diagnosed or perceived mental illnesses face significant challenges, not only from the condition itself, but also from the stigma and discrimination imposed by society. These individuals often experience judgment, blame, and exclusion, which can lead to barriers in accessing jobs, housing, and healthcare due to harmful stereotypes. Family members and caregivers are also affected, facing something called courtesy stigma, where they are judged or blamed for their loved one's condition. This can result in feelings of shame, isolation, and pressure to hide what they are going through. And for marginalized communities, the impact is even more severe. Racial and ethnic minorities, LGBTQ+ individuals, and low-income groups often face a double stigma, which is the stigma surrounding mental illness compounded by society or cultural prejudice. This can lead to reduced access to support and more negative healthcare experiences. In society, stigma around mental illness often shows up in the language we use. Words like crazy or psycho are casually thrown around, which reinforces the negative stereotypes and trivializing real mental health struggles. Media also plays a role by portraying individuals with mental illness as violent, dangerous, or unstable, further fueling fear and misunderstanding. Socially, people with mental illness often face exclusion. Others may avoid or isolate themselves due to stigma or discomfort, which deepens the discrimination. Systemic bias is also present, particularly in healthcare. One example is diagnostic overshadowing, where a patient's physical symptoms are assumed to be caused by their mental health condition, leading to missed or incorrect diagnoses. Individuals with mental illness may also experience less compassion in medical situations, feeling rushed through appointments, ignored, or not believed when they describe their symptoms. This often results in lower quality care, where mental health concerns are not treated as seriously or urgently as physical health issues. Bias also extends into work and education as well. People with mental health conditions may face job discrimination, being unfairly viewed as unreliable, less capable, or even unsuitable for certain roles. These biases create barriers that prevent individuals from reaching their full potential and reinforce harmful misconceptions about mental health. A study involving over 200 people published by Psychiatry Online highlights the significant discrimination faced by individuals with mental health conditions. In the study, 44% of participants reported experiencing discrimination when seeking or receiving mental health care, and additionally, 31% reported facing discrimination in general medical care settings. Biased thinking in healthcare settings can have serious and far reaching consequences. Unequal treatment often results from assumptions and stereotypes, leading to misdiagnoses, improper treatment, and poor management of both mental and physical health conditions. Access to care is compromised when healthcare providers allow bias to influence their decisions. The resulting stress and anxiety can further worsen patients' symptoms, exacerbating both mental and physical health issues. Bias also leads to patient distrust, causing reduced engagement with healthcare services and even avoidance of care altogether. A 2017 Lancet study found that individuals with mental illness are 3 times more likely to avoid healthcare services, and nearly 50% do not seek treatment due to fear of being stigmatized, as reported by the National Alliance on Mental Illness. Additionally, biased care can lower patient compliance with medical advice and treatment plans, undermining recovery and outcomes. These failures represent clear violations of ethical standards such as beneficence, non-maleficence, and justice, and can expose healthcare providers to serious legal repercussions, including malpractice claims. There are significant differences in health outcomes between groups, especially when mental health is involved. People with serious mental illnesses such as bipolar disorder and schizophrenia die 10 to 25 years earlier than the general population, according to the National Institute of Mental Health in 2020. Additionally, individuals with depression are 1.5 to 2 times more likely to develop chronic conditions like diabetes and heart disease compared to those without depression, as reported by the Centers for Disease Control and Prevention. Minority groups also face worse mental health outcomes. Black adults in the US, for example, are more likely to experience mental health challenges, yet are less likely to receive the care they need, with only about 1 in 3 Black adults who require mental health services actually receiving them, from the American Psychiatric Association in 2017. Furthermore, suicide risk is dramatically higher among LGBTQ youth, who are 4 times more likely to attempt suicide than their straight peers, largely due to stigma and discrimination, according to the Trevor Project in 2022. These disparities highlight the urgent need for more equitable access and quality mental health care. And although health coverage improved across all racial and ethnic groups after the Affordable Care Act and others in 2014, minority groups remain more likely to be uninsured compared to white individuals. And after 2017, coverage gains began to decline for 3 consecutive years. Several organizations and programs are actively working to address mental health disparities and reduce stigma in healthcare. The World Health Organization leads global efforts through its Mental Health and Substance Use Department. Its comprehensive mental health action plan from 2013 to 2030 aims to promote mental health, prevent mental disorders, and reduce stigma worldwide. One of whose key program, the Mental Health Gap Action Program, trains non-specialist healthcare providers in low-resource settings to better support mental health needs. In the United States, the National Alliance on Mental Illness focuses on education, support, and advocacy to reduce stigma both in healthcare and the broader community. NAMI runs programs like Ending the Silence and In Our Own Voice, which bring real-life stories into healthcare settings and schools to promote understanding and break down stigma. The Mental Health Parity and Addiction Equality Act, passed in 2008, is another major step towards fairness in mental health care. This U.S. law requires insurance plans to treat mental health and addiction services equally with physical health care. It ensures that individuals seeking mental health care are not charged more or limited in ways that physical health patients are not, helping to make mental health care more accessible and equitable. Globally, the Global Mental Health Peer Network is led by individuals with lived experience of mental health challenges. They focus on advocacy, empowerment, and reducing stigma within healthcare systems by ensuring that people with direct experience have a strong voice in shaping care practices. Through these initiatives, progress continues towards making mental health care more fair, accessible, and stigma free. To combat bias in healthcare settings, several key strategies can be implemented. Education and awareness training are essential. Mandatory bias training should be required for healthcare providers to help them recognize and address their own biases towards mental illness. Curriculum reform is also crucial, ensuring that mental health education is integrated into medical and nursing school programs. Incorporating case studies and simulations can also help future providers better understand the experiences of patients living with mental health conditions, fostering greater empathy and understanding. Promoting mental health literacy among all staff, both clinical and non-clinical, is also another important step. Educating staff about common mental illnesses, their symptoms, and the realities of recovery helps to dispel myths and challenge stereotypes. Highlighting real-life stories and resilience can further shift perspectives and promote a more positive, hopeful view of mental health recovery. At the individual level, it's crucial to encourage healthcare providers to reflect on their own implicit biases and assumptions. Self-awareness is the first step in mitigating these biases and providing more compassionate, equitable care. Additionally, supporting peer-led education and advocacy can be incredibly impactful, as individuals with lived experience can humanize mental health challenges and offer invaluable insights. This can also help to break down barriers of stigma. And in the workplace, fostering open conversations about mental health is essential. And by reducing shame and promoting empathy, it's possible to create an environment where mental health is openly discussed and individuals feel supported and understood, ultimately improving care and reducing stigma. At a systemic level, there are several critical strategies to reduce bias and improve mental health care. One of the most important is integrating mental health services into general medical care. This ensures that mental health is treated as a core aspect of overall health, which reduces stigma and improves access to care. Anti-stigma training for healthcare workers should also be mandatory, and incorporating real-life patient narratives can help providers understand the lived experiences of those with mental health conditions. In addition, mandatory training on implicit bias can help healthcare providers recognize and address their own unconscious prejudice, ultimately improving the quality of care they provide. And policy changes are also essential to ensuring mental health is prioritized equally with physical health. Policies should focus on mental health parity, ensuring that treatment for mental health conditions are not limited or treated differently than care for physical illnesses. Implementing anti-discrimination policies specific to mental health, along with accountability, can help create a more just and fair healthcare system. To improve the way we talk about mental illness and to create a more supportive environment, promoting language that humanizes individuals is essential. One key aspect is to use first-person language which focuses on the individual rather than their diagnosis. For example, saying a person living with schizophrenia instead of saying schizophrenic, or an individual with bipolar disorder instead of a bipolar person, emphasizes that mental illness is only one part of a person's identity. It's also crucial to refrain from using mental health terms casually. Phrases like, I'm so OCD about cleaning, or that's so depressing, trivialize real mental health conditions. And instead, for example, say things like, I like things very organized, or that's upsetting. Finally, we should use empowering, strength-based language that highlights recovery and resilience. For example, saying living in recovery, seeking support, or managing their condition is much more respectful and effective than referring to someone as suffering from or a victim of mental illness. And in healthcare settings, several improvement approaches can create more inclusive and compassionate environments. Enforcing anti discrimination policies, systems that allow patients to report stigma or bias safely and anonymously, and peer support and involvement with lived in experiences are also vital. Finally, encouraging healthcare workers to reflect on their own biases, using appropriate language, and integrating policies and training can address mental health related challenges and are important steps towards creating a more empathetic, patient centered system. Thank you.